2010, automatically banning new substances which mimic the effects of existing illegal drugs. The ACMD believes that such legislation should be further investigated and could work alongside the Misuse of Drugs Act, not as a replacement. This would serve to prevent manufacturers developing new and harmful compounds that avoid present legislation but are chemically and pharmacologically similar to presently controlled substances. To effectively tackle the issue of legal highs will require cross-government working and a multifaceted approach. There is no single solution to the problem. Our recommendations include the application of existing laws and consideration of new approaches to the issues. We believe that the burden of proof should be placed upon a supplier to show that the product being sold is safe for human consumption. Vendors currently avoid the Medicines Act by pretending that their products are not for human consumption or are research chemicals. Furthermore, products and vendors should not mislead consumers with labelling such as plant food or fish food, thereby allowing vendors to escape liability, apparently in violation of existing consumer protection laws, as the products are clearly not intended to be used in gardening or fish-keeping purposes. In terms of existing legislation, the ACMD has identified the Medicines Act, Consumer Protection Regulations, and General Product Safety Regulations as instruments that might be used. The ACMD also recommends that further resource should be made available to develop research on legal highs, including support of forensic capability, pharmacological profiling, public health initiatives and treatment. The Home Office Forensic Early Warning System and the Drugs Early Warning System schemes are welcome additions, but there is an urgent need for resources to allow the pharmacological profiling of new legal highs, for which there is often no previous scientific literature. ACMD is also very keenly aware that more research on the social aspects of legal high use and on new forms of treatment is also needed. Our recommendations emphasise the importance of developing international networks, including working at the EU level to restrict supply-side activity. We welcome the EU initiative published last week to fight dangerous new synthetic drugs. The ACMD believes it is important to maintain and strengthen public awareness of the dangers of using legal highs, particularly as for many of the substances in question, there is a complete absence of safety data. The content of school-based education and current provision of information on legal highs should be examined to see how it can be improved and strengthened. This is a very brief overview of the ACMD report, which seeks to offer a proactive approach to tackling the new problems posed by legal highs, rather than the reactive stance that we have so far been obliged to adopt. As I mentioned last Tuesday, Les, Annette and I were at this press conference to actually present the report, and I think the report was very positively received. There were questions on the origins of novel psychoactive substances, where they actually come from, who's actually manufacturing these materials. There was also a rather naive question on the long-term safety data associated with these materials, which of course doesn't exist. People at the press conference also wanted to know about the Analog Act, and there was quite a lot of interest on the data on methadone, particularly Dr. John Corpre's data from MP SAD. I certainly got the personal sense that there was a view that because these materials are legal, that they are safe, and this is certainly not the case. I think John's data goes a long way to show that that's certainly true. On Thursday, Les and I met the Interministerial Group on Drugs of Abuse. And at this meeting, there was also discussion on the ACMD's recommendations around consideration of the Analog Act and understanding the degree of its success in other countries in limiting the growth of legal high markets. There was a strong sense that the evidence base behind this approach should be tested. There was also discussion on the need to better understand the legal high market, in particular whether those using legal highs were new to drug use, or whether users of existing illegal drugs were switching between substances. Ministers wanted to know about the links between new psychoactive substances and serious organised crime, and education and messaging to young people about the dangers of illegal highs was discussed, particularly around the message, just because it is legal doesn't mean it's safe. So that concludes my presentation. I really wanted to thank personally all of the people who actually contributed to the report over the last 12 months. I'm very grateful for your input.
Yes, thank you. We could ask members of the council, not public as yet. You'll have a chance later on. Are there any questions from council members to Simon? If not, I think it's important to remember that the ACMD offers advice to government. It doesn't actually dictate policy, so we will wait and see what response we get from the various departments that may be involved in this. And we will, of course, be happy to consider further research on any aspect of the recommendations should the government so wish, but we'll have to wait and see what the response is. I'm going to turn next to some other items that have to do with the way in which ACMD works with government, and in particular the plans that we have to work with the Home Secretary on the new temporary banning drug orders, temporary class drug orders, which will be available to the Minister within a few weeks, in the middle of November, now that the Act has passed through Parliament. That first paper, I think, which is available to everyone, is that right? 7A, is a working protocol which we've been developing together with the Home Secretary and the Drugs Ministers over quite a long period of time to clarify just what the role of ACMD should be, what its membership should be, and how this relationship should work. As you may know, under some previous regimes, the relationship had not worked very well. The protocol covers a number of issues that concern ACMD, such as that when ACMD gives advice to government, there should be a due period of consideration before the government announces its response. In the past, it's not been uncommon for a response from government to be issued on the afternoon after the new advice has been offered in the morning, and that sort of gave the impression that we weren't being taken seriously enough. So that has been changed. We've also asked that the government should respond to any recommendation we make within a 3-month period. And in Whitehall, that 3 months may not seem very long, but we want to know what the response is. We want to have some ability to follow up what actions are taken. There was also the question of when the ACMD was originally constituted, there were 6 statutory positions that we had to have filled at all times. These included a vet, a doctor, and I can't remember the other 4, but a chemist, etc. So what the Act has done, the new Act which covers temporary class drug orders, also abolished these 6 statutory positions. However, we wrote in to the protocol that various areas of expertise, including chemistry, pharmacology, etc., should always be represented in the membership of ACMD, so that there was no question of losing these positions. It was losing the unfortunate issue that if a member of council holding one of these statutory positions resigned or retired, that position couldn't be filled immediately, and meanwhile the council would be inquorate and unable to make any recommendations. So that was a nuisance factor which has been done away with. The other parts of this process have to do with the forthcoming temporary class drug orders, which, as you know, gives the Home Secretary the mandate to place any particular compound that is conceived as being a harmful agent immediately to be subject to an immediate ban, which accelerates the otherwise rather much slower process that we have at the moment. ACMD are clearly involved in this because once a substance has been placed in the temporary class, it only remains there for 12 months. And during that period, the ACMD will have to investigate the background to that substance and will have to draft a report of what evidence is available and a conclusion about the recommendation as to whether this substance is harmful and whether it should be controlled under the Misuse of Drugs Act. So whenever a temporary class drug order is laid, ACMD are going to be given the job of studying that compound. So we have asked, number one, that there shouldn't be too many of these in any one year, given our limited resources. Remember, the ACMD is a group of 26 professional expert people who most of them have other jobs, and they are unpaid voluntary workers to the ACMD Council. So we can't stretch the ACMD resources any more than they already are, and Will Reynolds, our secretary, to my right, will tell you quite truthfully that the Secretariat is very overstretched at the moment, having lost some of its members due to the general cuts in government finance. So we can't ask too much of the Secretariat or the Council, and if we had several temporary class drug orders laid at once, we would be faced with a really big problem. But I'm pleased to say that our lobbying that the ACMD should be involved right from the very beginning in the choice of what drugs should be subject to such orders has been accepted, and we will now be working with government, with the Home Secretary, to decide when such an order should be laid, and we'll have the opportunity to be there right at the very beginning. There are a couple of other papers that have been prepared and will be discussed in closed session this afternoon, which have to do with the process by which this temporary class ban will be laid, and given the fact that this is meant to be a quick mechanism, we will not have a great deal of time available to make our decisions. But we have a process worked out in draft, and we also have another document which works out just what sort of criteria need to be fulfilled before we consider a substance sufficiently harmful to justify this sort of emergency action. So these two papers will be considered this afternoon. And it's worth noting that the Police Reform and Social Responsibility Act, under which these changes in the Misuse of Drugs Act were included, means that the ACMD no longer has this statutory membership requirement, and we welcome we welcome this act, we welcome the temporary class drug orders, and we're quite satisfied with the protocol that defines which areas of expertise, otherwise previously filled by statutory members, which areas of expertise should be maintained. I'm going to hand over to Ray Hill, who will talk about the technical committee, one of our large subcommittees.
Thank you very much, Les. So the technical committee is a standing body of the ACMD, whose purpose is to consider and make recommendations for classification and scheduling under the Misuse of Drugs Act. And where there's a large piece of work needs doing, the technical committee may form a working group to carry out specific reviews of specific drugs. And we've met twice since the last ACMD meeting, once in July and once in October. At our July meeting, we considered phenazepam, the substance that Les just mentioned to you, and as a result of this, a recommendation was made to ACMD that was subsequently passed on to the Home Office, and details of this advice are now available on the website for those that are interested. An ongoing piece of work that we're engaged with at the moment is consideration of an analgesic drug called tramadol. We were told that this drug has been implicated in a number of deaths, and as it has, as part of its pharmacology, opioid properties, there have been some examples of dependence reported as well. And we hear that as a drug called coproxamol has been removed from the market, it looks as though tramadol is being diverted from clinical use to fill this gap as a readily available drug of abuse. And it's also been noticed that a metabolite of tramadol is being offered for sale in its own right, and this substance also has some opioid properties. And so we're at present trying to put a recommendation together for ACMD to pass on, and we'll come back to this at our meeting later today, principally to discuss a number of options as how the control of this particular drug may be handled. We've also had advice from the Home Office and discussed possible changes to the misuse of drugs regulations going forward, and again, this is work in progress that the technical committee will consider.